Abna, good morning. Okay, so this is for the mother. This is the mother's test result, electronically signed off by Daniel Apo of Sign Lab. That is for the mother. Now let's check out for the daughter as well. This little innocent girl is also 5 years old. 5 years old, she's female. Sign Lab received on the same date like her mother. Hers was taken later. Remember, her mother's was taken around 3 p.m. Hers was taken at 4:15 p.m. Of course, mother will have to try it first. If she doesn't go, then the daughter can try. So 4:15, and it was released to them on the next day. She got her test result the next day, the 9th of February at 2:03 p.m. That's the final one. She's also tested positive. And the footnote here says that the active viral replication and potential for viral transmission cannot be concluded. Clinical correlation with patient history and other diagnostic information is necessary to determine patient infection status. This is what she shared with us yesterday. And guess what? These are some of the drugs that was given to her for her to be able to deal with. So we'll get some more information from her, but this is the mix of drugs presently that she's using to run her life. Okay, now let's try and work the phone lines and try and get her. And then she will also explain to us what this one means. This is from another hospital that she had visited earlier, had seen her, given her excuse duty for 2 days. That is also on the 4th of February 2021 to the 5th of February 2021. So get the dates. She did the COVID test on the 2nd, okay, on the 8th, and her daughter did on the 9th. She did her COVID test on the 8th. Her daughter did on the 9th. Now, she had gone to the hospital on the 4th of February 2021, gotten an excuse duty, okay, that would last till the 5th of February 2021. And it says that she has been seen and treated, signed off, and then she was due for a review on the 7th of February 2021. It was signed off. We have had to keep the name of the hospital and that of the doctor out for obvious reasons. So that's the situation. Mother and daughter, who both have tested positive for COVID, and the chronology of the activities is what I want to run you by. Abna is joining us on the phone line now. Abna, thank you very much for your time. Good morning.
Good morning, Johnny.
And how are you doing?
I'm very well, thank you.
Great, and thank you very much for availing yourself to speak to us for public education and also to vet how the system works in this country. Now, I've been showing to my viewers some of the detail you shared with me, your COVID-19 test results. We're grateful for that. That of your daughter as well. The excuse duty you got from the hospital where you attended. We'd like to keep the names of the hospitals out. But you tell me, how did you receive the news of you testing positive for COVID-19?
Okay, so I fell sick last week, Thursday, and I quickly dropped my daughter in school, and I went to the hospital to see the doctor. Upon several examinations and a lab test, the doctor said I had typhoid. So I was given some medication and an IV, and then I was discharged later in the day. I was expecting to get better by the weekend, but after Saturday evening, I was still not feeling well. So I went back to the hospital on Sunday, and the doctor said, although I tested negative for malaria, they were thinking that I have, although I tested negative for malaria,
Go ahead.
They wanted to treat me for malaria because I had clinical symptoms of malaria. So I was given malaria medication, and that was typhoid, and I was on treatment. But I was still not getting better. So on Sunday evening, it was getting very bad. And I was having pains all over my body, severe headaches. I wasn't coughing. So I went to the Sign Lab on Monday to go and do the COVID test. And it came out positive.
Now, how did you get into harm's way with COVID?
I can't say for a fact, but my daughter is of school-going age. She's 5 years old.
Okay.
And she also tested positive, by the way.
I see. Don't say the name of the school, by the way.
That's the funny part. She's also she doesn't have any headache. I thought it was right to do the test and then.
So let me get it straight. You tested first, or your daughter did? I want to understand.
We went to the hospital and then out, came back again, and she did it.
Hello? Your line is breaking. Hello?
Hi.
Your line is breaking. Yes. So which one of you tested first? Per what we've seen, you did the first test and then your daughter followed.
We did the test on the same day, but I did mine earlier and later on went to do hers because it's 420 Johnny for each. So that was like 840 cedis for the both of us.
I see.
So yeah, I did my test and then later in the day we went to do hers. So I got my results earlier before hers.
I see. Now, the government says that COVID-19 test is free if it is recommended from a hospital, a clinic, or what have you. You are telling us on this show today that the hospital that saw to you said you had malaria and typhoid, correct?
Exactly. And when I went to the hospital on Sunday, I requested that they give me a letter or a note to the hospital to Kolebu for the COVID test, which I understand was free there. Right. But the doctor said I don't have COVID symptoms. And after testing my chest, they think that I don't have COVID symptoms. So I should treat the malaria and I'll be fine. So I decided to go and do it at the Fine Lab since it was working. Okay. And I paid cash for it.
So
and funny enough, it came out and it's positive.
So this was your initiative, not that of the hospital?
Not at all. The doctor did not ask me to do it. He said I don't have COVID symptoms.
Okay.
And he was not ready to give me the referral letter.
I see. Now, did you insist on getting that referral letter even though you knew what you were feeling?
Yeah, I did. I remember when I went there, I spoke to the doctor and I insisted because when you are giving medication, you should see some improvement.
Right.
So after taking the typhoid medication from Thursday, it wasn't getting any better, And so I went back and they said malaria, but I tested negative to malaria. So why are you giving me malaria medication? So I wanted to be covered because I take my daughter to school. I take her up without mask. That's one thing.
Right.
And she's 5 years. She comes home and she has poured water and a sanitizer. The mommy was finishing and I had to add water. So I am taking care of myself, but I was not so sure about what she was doing in school.
Right.
So I really wanted to do the COVID. So when he was not willing to give me the letter, the reference letter, I decided to walk into Fine Lab.
Did you?
To do it. And I paid cash for it.
Did you revert to the doctor? Because on the hospital form you sent me, the leave form, shows that you were due for a review on the 7th. You went to do the COVID test on the 8th of February. Did you get back to the hospital to tell them, I don't think I'm getting any better with the medication you have given me for typhoid and malaria. I still insist you should give me a COVID form?
Yeah, so when I went, so the thing happened on Thursday. The first time I went to the hospital was on Thursday, and I did the test. I tested negative for malaria and positive for typhoid.
I see.
So when I was giving the typhoid medication and I wasn't getting better, my review was on the 7th. So I went back, the doctor, I am not getting any better.
Right.
And then she insisted that, okay, if I'm not getting any better, she thinks that they can treat me for malaria, although I tested negative for malaria because I'm showing clinical symptoms of malaria.
I see. Now, so what is it? Do you suspect that your daughter may have brought this from school or what? You could have brought it from work.
That's what I think, because so far in my office, I'm the only person who fell sick, and I'm the only person home. So my colleagues are still in the office, they are working. Nobody's complaining. I am the only one.
I see. But both you and your daughter, apart from you showing those symptoms of feeling weak and feverish and headache and all of that, your daughter, did she show signs as well?
She is fine. There's nothing wrong with her. She is so fine. She's not coughing. She's not sneezing. She's not complaining of headache. She eats well. She's jumping around here and there. Yes. I mean, when I got my results, I actually sent it to my sister because I was panicking.
Okay.
And then I went for her and I realized that she also had hers was also positive. So I had to quickly go for her. So we are home together. And I've asked my sister to also go and do the test because my daughter stayed with her for a day.
Okay. You and your daughter are self-isolating.
Exactly. We are in the house.
Have you tried to reach out to your daughter's school, because she's been in school for 3 to 4 weeks? Have you tried to reach out to the school to tell them that this is the situation?
I sent the results to the head of the department, and I told her that my daughter had tested positive. So if she's not seeing him, so this is the reason. So we are self-isolating.
And what was their response?
And she asked that I don't inform any parents about it. I
Really?
don't tell any other students or anyone that my daughter has tested positive because of the stigmatization. And so we should be home because it's going to affect other parents and other students if they get to know that my daughter tested positive.
If your daughter is, I'm quite shocked at this, that the school, somebody in the school is asking you not to tell other parents about it. Did you oblige to this request not to tell other parents, because that could be dire?
I don't have friends in the school, as in the parents. I don't have them as friends. I haven't really informed anybody. But I think that it is not a good thing to do, because if it happens, other kids will still be going to school.
Right.
I'm sure she has friends she has been playing with, and so they might have also contacted us and they'll be giving it to their parents and all that. So I was expecting them to either close down the school, test the children in the school or something, but I've not heard anything from them. They only asked that I don't tell anyone about it, and then when she's fine, I bring her back.
Your daughter is 5 years, correct?
Yes.
So that means she is not yet in class 1. She could be in kindergarten or something like that. And usually we know how they hobnob with each other. For you as a parent, hearing this from the school and not having friends, have you, how do you feel about it? The danger that some other parents might have gotten it, given to the child, and your child may have picked it up. How do you feel?
Johnny, I'm not happy about it, because I'm sure that maybe a child also tested positive. The school was aware. They never told us, and my daughter maybe had wanted to play with that child and brought it to me. So I was expecting the school to inform parents, because they usually send emails and SMS and all that to ask for school fees and all that. So they should equally communicate to us that we should run the test, or they are breaking the KG2 for some time or something like that. But nothing of that sort happened. So I want to believe that other kids are going to get it. It's going to continue spreading around. Maybe she also got it from somebody whose parents got it, or a child she played with, that kind of thing.
So what are your options now? If your child gets better, are you taking your child back to that school? How do you feel about your child going back to school?
It has been hard for me. I mean, I've been thinking about her education, because, you know, this is their formative age, and then school is very important. So it's hard for me knowing that she's not, she tested positive. So I've been thinking, after this, am I taking her back to the school? What if she gets an infection again and I have to, you know, that kind of thing. So I've been thinking, who is going to take care of her if I have to go back to work? Do I take her to the school now that she has tested negative? I can't, I don't know. And I know that people can test positive again after, you know, they have recovered. So I'm not really sure on what to do right now. I'm so confused about what to do. Taking her back to school or letting her stay at home. I don't know what to do.
I see. Now, is this a public school or a private school?
It's a private school.
Private school?
Yeah.
Wow. So they're supposed to be observing all the protocols, washing of hands, wear a mask, social distancing, blah, 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 correct?
Exactly. Exactly. They even have the Veronica buckets outside that the children wash their hands, and they insist on they wearing the mask. But you pick them up and you don't even know where the mask is. So when I asked her, she told me the mask is in my bag. So, yeah.
Since you got COVID, we are told that the labs are connected to hospitals. Has anybody tried to reach out to you, at least from the lab, from a government hospital, an isolation center? Under whose instruction are you self-isolating?
Nobody has called me to tell me anything. Nobody has reached out to me to ask me how I'm feeling, whether I'm isolating or not. Nobody's doing anything. And nobody even knows I've tested positive. So I can go out. I can go out and do anything I want, even without my mask. Nobody will know.
Nobody has tried to trace the people you have connected with? Is that what you're saying?
Nobody has contacted me. Nobody.
But this lab, they know that you tested positive. And
Exactly.
we are told that the processes is that once you test positive, somebody will trace you. So how come
Nobody
your
has
case is
traced me,
different?
Tony. They only sent my results to me. No one has called me. Nobody has said anything to me. Nothing. Nobody has contacted me to ask for my medication. Nobody has said anything to me.
I've seen that you sent me a pack of medication that you've been taking.
Yes.
Are you able to explain how you got them? The hospital gave you, the lab gave you. How did you get them?
So when I went for the malaria, and when I went to hospital for the typhoid, I was given some antibiotics. The malaria too, I was given some medication. And when I tested positive, I called the doctor friend, and he wrote a list of medications for me.
Okay.
And he actually got them for me, and I met him up somewhere, and I picked it up.
Would you, if a request comes through for you to be at an isolation center, would you oblige?
No.
Why not?
I don't think I want to be to an isolation center because I hear a lot of people are dying there, and I don't want to go and die.
But psychologically, tell me, how has this affected you in terms of you wanting to return to work? How has it affected you?
Because of the stigma, I think I have not told a lot of people. It's only my boss in the office I told, and a couple of friends, my immediate family, that this is what is happening. So I'm home, and so nobody really knows. So I can just walk back to the office and do my work. And you see, Tony, I feel that there are a lot of people watching, and they don't know they even have it. You see people coughing and sneezing, and they don't bother to go and test.
Right.
So it's a mere cough. And it's like people have recovered that I also know. So I think it's a normal thing that like all of us are going to get. So I'll just go back to work and then probably send her back to school.
But somebody needs to certify that you have recovered. Now you are not on any government or any health person's list. The lab has not connected you to any of the health facilities as we're told will be done.
Like that.
How long are you supposed to be self-isolated at home with your daughter, and how would you know if you are better?
So I'm taking the medication, and I'm thinking that after a week or two, I'll go back to go and test.
At your expense? At your expense?
Exactly. But if I don't have the money, I'll go back to work. I mean, if I'm fine, I don't have those pains that I'm seeing, the headache, and I'll go back to work.
But this test result, maybe final question to you, this test result, when you got it, did you take it back to this hospital to show to the doctor that I have COVID? So the nurse who may have taken my vitals at the OPD could be at a risk too?
It's funny. When I walk in and they are checking my vitals, they're not wearing gloves, nothing. And they are not wearing gloves. There's just a nose mask. Sometimes it's even at their chin. And it's funny. Even when the doctor tested the medication to me, he said he was going to get it for me later in the evening. He wasn't coming, so I decided to walk to the pharmacy myself. I got there and I was showing it to the pharmacist. She touched the phone, and I told her not to touch my phone. And I think for some reason she realized I had COVID because of the way I looked at her and I was in my mask, and I asked her not to touch my phone. Quickly she went to wash her hand and she had to grab the mask. So it's just the weekend. She's at the pharmacy. She's wearing her mask. She don't know who I am. It's like the health of it.
Your line is breaking. They were not wearing masks or gloves. That's what you're saying?
No gloves. She actually touched me with her hand to check my vitals, to check my BP and all that. She touched me with her bare hand.
And this is in Accra?
Yes, in Accra.
Jesus. Abna, I thank you very much, and we will connect with you. I'll try and connect you with the health officials so that you can get proper care and attention, and that's for your daughter as well, so that we don't assume that this is over, and so you get the best of care and recover quickly. I wish you all the best.
Very much.
And that's Abna, as we like to call her, not her real name, but you heard the story. She tested positive, her daughter tested positive. There's a lab certified and okayed by the Ghana Health Service and the ministry to be able to run these tests and not to run them down. But we're just trying to connect the dots as to what happens. If I walk into a private lab without an authority note from a clinic, a CHIP compound, or a hospital, and that test is done, how do we transmit that record to the national grid to add on to it? Possibly, her case may not have been recorded as part of what I just showed you. and she is self-isolating, courtesy the help of a friend doctor taking medication. But how will she know if she's well or not? And there could be many like that walking around. So you have to wear your mask, you have to wash your hands, you have to maintain social distancing, you have to exercise, eat right, keep hope alive, but also be very, very smart and wise. COVID is everywhere. We'll see you after the break.